Hello everyone. Today our topic of revision is micturition and associated controls, and later we will discuss on a very important topic in medicine, that is neurogenic bladder. First আমরা এখানে দেখছি this is a urinary bladder, longitudinal section of the urinary bladder with urethra and two ureters. Here it is depicted internal sphincter and the external sphincter. Internal sphincter is present just at the neck of the bladder and external sphincter is present more distal to it, more superficially. Detrusor muscle has three types of fiber: longitudinal, transverse and spiral, and all these muscle fibers when contract it causes intravesicular pressure rise and thus micturition occurs. Now coming to the nerve supply. There is two types of nerve supply as other viscera: autonomic and somatic. Autonomic type is of two types, sympathetic and parasympathetic. Sympathetic nerve fibers arise from T12 to L2 spinal segment, and the nerve fibers transverse via hypogastric nerve, which ultimately reaches the detrusor muscle and the internal sphincter. In case of detrusor muscle, it causes relaxation. Negative sign means relaxation and positive sign means contraction. So sympathetic nerve fibers will relax the detrusor muscle, whereas contract the internal sphincter. Similarly, just opposite to the action, parasympathetic, which arises from the S2 to S4 spinal segment, it traverses via a nerve called pelvic splanchnic nerve. It will contract the detrusor muscle and relax the internal sphincter. So from this we can easily understand that sympathetic will relax the detrusor muscle. So more amount of volume can be stored now, more amount of urine can be stored in the urinary bladder, and it will contract the internal sphincter, so the outlet is closed. Hence it's called nerve of filling, because more amount of urine is filled from ureter to the bladder. And just opposite to the parasympathetic, it will contract, so the urine is trying to pass out and the internal sphincter is also open due to the relaxation. Hence it's called nerve of voiding. Another nerve, pudendal nerve, which is a somatic branch, it supplies external sphincter. So one individual can voluntarily control his or her micturition with respect to time and place. Another muscle, perineal muscle, somewhat controls micturition. That is, when the bladder is not filled, then also one individual can micturate by contracting the perineal muscle, and this can occur by lowering the pelvic wall, so that perineal muscle is contracted and thereby internal sphincter is relaxed and urine can be passed off even when the bladder is not filled. Now coming to the reflex, and the reflex center is present, and the reflex is mainly spinal reflex, which is present in sacral segment S2 to S4. There are various stretch receptors present on the wall of the detrusor muscle. When the urinary bladder is stretched out due to the pressure raise, it sends some afferent signals which will reach in the spinal reflex center, and ultimately it sends efferent signals via this parasympathetic fiber. Thus a spinal reflex arc is constituted. Now others higher center, that is in the pons, the center is called Barrington center, and in more higher center like in cerebral cortex, more accurately prefrontal area, regulates micturition. That is, socially accustomed micturition is regulated by cerebral cortex. So this is all about micturition. Now coming to another topic, that is pressure rise in bladder. The rise of pressure in bladder can be experimentally observed in cystometrogram, and here is the graph. The y-axis denotes intravesicular pressure change and x-axis denotes volume change. With volume change, pressure should be raised, and 1A and 2 shows that property, but there is a flatness in the 1B, and the reason behind this 1B can be explained with the help of Laplace law. From Laplace law, we know P equal to 2T by R. After a certain limit, that is after a certain tension change, the detrusor muscle shows plasticity, and after that it will be relaxed. So radius of the bladder is also increased. So as we increasing the tension by more amount of volume entry, the radius is also increasing simultaneously, so that the ratio is constant and there is no pressure change. So what happened? Detrusor muscle shows plasticity, and according to Laplace law, P equal to 2T by R, with rise in the wall tension, that is due to the volume entry, as the detrusor relax, diameter also increases accordingly, and the net pressure change remains almost zero. So there is a reason behind this flatness of the 1B. And where the 1B ends, that is the volume of 400 ml, it causes strong urge for micturition. Now coming to some pathological condition, and this type of bladder is called neurogenic bladder. So first we look for a condition where there is an injury occurring at the sacral parasympathetic nerve fiber. We know that parasympathetic is nerve of voiding. When these nerve fibers will be injured, the sympathetic will take upper hand, and as a result there will be inhibition of voiding. Bladder will be overfilled and overstretched. On abdominal palpation, a fluctuant cystic swelling that is tender to touch may be palpable in the suprapubic area. As intravesical pressure is raises, drops of urine can be dribbled out, causing overflow incontinence, and the bladder may be called atonic bladder. Another condition, when this lumbar segments is damaged, so the sympathetic or nerve of feeling is not working and the parasympathetic takes upper hand. So in this condition, if there is damage to the lumbar of sympathetic spinal cord, there will be loss of bladder relaxation because it is a nerve of feeling. This will cause in a contracted shrunken bladder with increased urge and frequency of micturition, and the residual urine volume will be very low. There will be urge incontinence because the parasympathetic or nerve voiding takes upper hand, and the bladder may be called hyperactive bladder. So this is the main two types of neurogenic bladder. In one case the parasympathetic spinal segment is damaged, and one case sympathetic spinal segment is damaged. Now another type of condition, if the injury occurs above the thoracolumbar segment, that is the spinal reflex center, then local micturition reflex is regulated by the lumbosacral segment and the normal micturition reflex is intact. However, control from the higher center is absent. There will be reflex micturition without the voluntary control, and the bladder is called autonomic bladder because the higher center is not sending any signal. So only the autonomic control is there, and it's called autonomic bladder. Another is more higher centers like prefrontal cortex or Barrington center in the pons is damaged, and as a result there will be loss of the social condition, that is one individual cannot control his or her micturition in socially unaccustomed area or time. So this is all about the micturition related condition, and these are called neurogenic bladder. So number one is atonic bladder. It is caused due to injury in parasympathetic nerve fibers. Hyperactive bladder, it is due to damage of the lumbar sympathetic cord. And autonomic bladder, here the higher centers are damaged. And finally the prefrontal area or prefrontal cortex area is damaged, so there is a loss of social inhibition. So this is all about micturition and neurogenic bladder. Thank you guys for watching.